many of you have chronic headaches, sit at the desk for too long hours, and also look at your mobile phone or electronic device for far too long looking down? Well, this can manifest into lots of many problems, and in this video we're going to talk about one of the most common problems that you can get for these forward rounded postures and forward head postures, known as Levator Scapulae Syndrome. So to begin with, I'm going to show you the back here. So the levator scapulae muscle comes from C1, C2, C3 or C4, and it attaches from the posterior tubercles of the transverse processes, and it comes down and inserts onto the superior, meaning top angle, and medial, meaning middle, of the shoulder blade, which is also known as the scapula. Symptoms can range from very deep aching feelings around this point. You may also find it's very lumpy and bumpy or gristly when you touch it, and very tender as well. You might find you have upper neck pain in the upper trapezius region. Your motion of the neck may be reduced, so when you turn left and right it could be painful as well, and when you look up to the ceiling you may get symptoms referring back down into this area here. So the role of the levator scapulae muscle helps elevate the scapula, so bringing the shoulder blade upwards. It can assist in retraction, meaning it brings the shoulder blades backwards to the midline of the body. And it also helps with side bending of the neck, known as lateral flexion, when you bend from left to right. So if this becomes problematic with a forward rounded posture or forward head posture, it becomes eccentrically lengthened, meaning it's in a lengthened position, and the force of being in that forward head posture or rounded posture is causing more forceful actions on the insertion point here, causing inflammation and pain to occur. And if you're not addressing the biomechanical deficits that you are doing every day that's potentially causing this forward rounded posture, then all that's going to happen, it goes round in a vicious cycle of pain and inflammation, so it won't improve. So how can you improve Levator Scapulae Syndrome? One of the best ways to improve it is not actually to rub on the site of pain, as this can only irritate and cause more inflammation and prolong the painful symptoms. So what you can do, you'll find that when you have rounded posture or you sit at the desk for too long, the weak, so the mid trapezius and the rhomboids, which sit between the shoulder blades, become weak and inhibited, so they allow too much forward movement to occur, and this can cause pain in the mid part of the back, and again causing the shoulder blade to come outwards, putting more strain on the insertion point of the levator scapulae muscle. And then you have the chest area where we have the pectoral muscles. They become very short and tight, and they will take over a lot of the role, causing the mid trapezius and the rhomboids to become very weak. If this happens, you then have to lengthen the pectorals, which will then hopefully bring some shortening back of the rhomboids and the mid trapezius, which will help them activate and fire up more efficiently within the nervous system. So I am now going to show you 3 active lengthening exercises you can do to help open up the chest and then activate by strengthening the mid trapezius and the rhomboids. I hope you enjoy the exercises. So in this part of the video, I'm going to show you 3 pectoral active lengthening exercises you can do daily to help open up the chest area, the pectoral muscles, and strengthen the mid trapezius and the rhomboids between the shoulder blades. As mentioned in the video earlier on, having weak rhomboids and mid trapezius will cause this rounded posture to occur, and you'll have a lot of outward rotation of the shoulder blade, which could then lead to shoulder problems and neck problems, but in this case, Levator Scapulae Syndrome. So one of the most important things is to be aware of is that when you have weak muscles, so in this case the mid-trapezius and the rhomboids, it is okay to strengthen them, but because we have short and tight muscles on the opposite side, it will inhibit the weak muscles, which mean neurologically they can't fire up very well. So if you're trying to strengthen muscles without lengthening the short muscles on the antagonists, then unfortunately you'll just have a battle going on between the two, and the strengthening program probably won't have the desired effects that you are looking for. So there's a mnemonic that you can use and remember, and it's lengthen before you strengthen. So in this case, we are going to lengthen the pectorals and then strengthen the mid-trapezius and the rhomboids. So let's begin with the first exercise, known as active pectoral lengthening. So in this first one, you're going to begin by having your hands onto your lower back in this position here. And you're going to have your feet just a little bit apart from each other, nice relaxed body, and a head in a neutral alignment facing forward and a good posture. What you're going to do first is you're going to roll forward at the elbows and the shoulders, and this will activate the pectorals. Now, this is known as isometric contraction, so there's no motion. After 5 seconds, you're then going to begin by squeezing your shoulder blades back together. And if you take a nice deep breath in, you're going to feel nice lengthening, elongating of the chest muscles. Hold that for 5 seconds. And then release. Come back to your isometric positioning, so you're activating the pec muscles. And again, begin to come back, really squeezing those shoulder blades back together as well. So you're going to be strengthening the rhomboids and the mid-trapezius and lengthening the pectoral chest muscles. Once you've done 5 seconds, come back and you can repeat that 5 times, and that's known as the pectoral active lengthening exercise. So this next exercise is known as the pectoral active lengthening horizontal. Have your hands out in front of you, and then what you're going to do, begin with, again, isometrically contracting by pushing both your hands towards each other, so you're pushing them inwards. Hold for 5 seconds. Once 5 seconds is up, come into the horizontal plane, again squeezing your shoulder blades back together with retraction, and this will be strengthening the mid-trapezius and the rhomboids and elongating the pectorals once again. Repeat that 5 times, so 5 second holds, 5 seconds up, come back and hold for 5. And then that will be the horizontal pectoral active lengthening, and that's really good again for opening up the chest and strengthening the mid-trapezius and the rhomboids. So the next exercise I'm going to show you is going to be for the shoulder adductors. So this time you're going to stand with your hands at the side onto your hips, and then you're going to begin by pressing inwards towards your hips, so isometrically contracting the shoulder adductors. On the release phase, you're going to come out and begin to rotate the hands outwards with the palms facing forwards, going up into a nice stretch position up here like so. Holding that for 5 seconds, activating now the shoulder abductors. And this is going to be in the deltoid and supraspinatus as you've rotated your hands out, and then you come back down to your start position, and you would repeat this 5 times again. So with these exercises, you can do them on a daily basis. If you've been sat for prolonged periods at your desk at work, or you've been driving for long periods, then you can do these. They're very easy, very simple, but they will help give you a much more feeling of a straighter posture, while stretching the short and tight pectoral muscles and strengthening the rhomboids and the mid-trapezius. I hope you enjoyed this video, and I look forward to seeing you all very soon. If you have any questions, please leave in the comment box below, and please subscribe to my channel.